Josephine Mtashi, a resident of Navaholo, Kakamega County, who could have been a victim of one of the most frequent killers of women during childbirth, postpartum hemorrhage.
Nilikuwa nasikia nguvu zikiisha.
I was getting weaker the more I bled.
Kwanza kwa akili kitu ambayo ilikuja kwanza nilikuwa nafikiria watoto.
I thought about how my children would suffer when I die.
But today she is alive and strong enough to take care of her young family thanks to a locally produced version of the uterine balloon tamponade, an innovation rolled out in Turkana, Kakamega, Bungoma and Garissa counties in Kenya.
It's an innovation whereby you balloon the ordinary condom in the uterus and it will stop bleeding. The doctors and nurses call it the magic balloon because you insert it on time, you'll control that bleeding. By the time the surgeon or the anesthetist arrives, we have controlled the bleeding. We have saved the life, we have saved the uterus.
Mary is just one of the many women and babies in Kenya whose lives have been saved by simple and affordable innovations identified and supported by the County Innovation Challenge Fund.
We have been able to reach over 1,000 health facilities with UBT in all these counties. We have gone beyond just Turkana, Garissa, Bungoma and Kakamega. So there is that effect that we are seeing in the country which is coming from the CICF counties. We are now in the region. We have even shipped UBTs to Ivory Coast. They are calling us because the evidence is coming from Kenya.
The fund was created in 2015 as one of the components under the Maternal and Newborn Improvement Money Program in Kenya, designed to reduce maternal and newborn mortality.
We are making progress improving maternal and newborn health in Kenya, but the pace of that progress is not moving fast enough. So the CICF steps into that space to catalyze change and break boundaries. We do that by testing new innovations and taking proven innovations to scale. All of the CICF projects are selected through an open and competitive process. We really try to invest in the ideas that have the greatest potential to unlock bottlenecks and improve maternal and newborn health.
So far, the fund has identified and successfully developed 19 innovation ideas into promising maternal and neonatal healthcare solutions in 6 counties with different socio-demographic contexts.
Some of the innovations we fund really caught our eye because they offer private sector solutions that have the potential to become financially self-sustaining. A really great example is the Ubuntu Afya kiosk project in Homa Bay County.
The kiosks are innovative community clinics that are set up and operated through a unique private, public and community partnership.
And it's unique in the co-ownership model with the communities that we target, who participate in developing the centers and by virtue of their involvement get almost 50% ownership of these facilities, and in the incorporation of supplementary enterprises whose revenue help to subsidize the cost of care. That way we are able to intervene in spaces that have previously not been considered viable for private health enterprise.
To date, a total of 16 remote kiosks have been established in remote areas that were previously underserved by the public health system and shunned by private providers.
When a mother comes, they come bare-handed with only the towels plus the clothes for the child.
Apart from the services we are getting here, most of members have borrowed the money and many people are encouraging to run their own businesses. And some of them are managing to pay their school fee.
Ubuntu has been able to create community partnerships to be able to teach the mothers, teach the community so that they own their health and they can reach out to access care which has been placed at the facility.
The fund also supports innovations and concepts that have already succeeded elsewhere and offer the possibility of improving local health indicators if piloted in Kenya.
We are setting up the first pilot human milk bank in Nairobi to determine a model for the country. And we intend that in future, over the next few years, we will start to expand this human milk bank concept and their integrated interventions into all the counties in Kenya. This way, we have impacted on about 40% of the neonates who are born preterm and low birth weight in the entire country, and helped to avert about 15% of mortality related to lack of access to human milk.
By rolling out innovations and scaling up solutions that are high impact and affordable, the fund is unlocking barriers and accelerating Kenya's progress to reducing maternal and newborn death. So far, more than 35,000 mothers and babies have received better health services as a result of CICF support to 400 health facilities, training of 2,500 health workers, and participation and influence in the development of 6 key policies relating to maternal and newborn health.
Currently, innovations is one of the key pillars of the Ministry of Health, and even for the government. And in particular for maternal and child health, we feel like in order to accelerate or in order to make a good progress, we need to have new ideas, new technology, new solutions. As a ministry, we are working with several partners to come up with innovations, to come with new ideas and use them in solving some of our health problems, in particular for maternal and child health. The County Innovation Challenge Fund is one of the partners that has been helpful in terms of coming with ideas, working with the county governments, and implementing innovative ideas within the country.